This week, Austin health authorities announced the Omicron variant is the dominant COVID-19 strain in our area. The CDC says Omicron is more contagious than the Delta variant, spreading and doubling every couple of days. Rising COVID cases in our area have medical experts renewing their plea for everyone to wear a mask. But one consumer group warns not all facial coverings protect equally against Omicron. The KVUE Defenders took a look at how you can spot counterfeit masks. Here's investigative reporter Jenny Lee.
The message is clear.
Really continuing to practice those prevention strategies like masking in indoor settings.
Now more than ever.
And protect yourself by wearing a mask.
Doctors say this is the time to arm ourselves.
And now with Omicron, we know it's important to get boosted as well. Wearing masks that we know prevent transmission.
But what type of mask matters? According to Project N95, the national nonprofit connects authentic personal protective equipment to people who need them. Executive Director Ann Miller says it's all about quality and fit.
I think it's really important now, given how many people that we know that have done everything they can to be protected and have still gotten COVID. So it's really important that everybody wear high quality respiratory protection.
High quality means the gold standard of masks, the N95 respirator.
And it's going to filter greater than or equal to 95% as 0.3 micron. You know you're getting protection with that.
Miller says if you can't upgrade to the N95, there are certain models of the KN95 masks that are acceptable. Same for the certain models of the KF94, but she warns you can't just look for these brands without further research because there are so many counterfeits out there. On December 17th, the CDC updated its page on counterfeit respirators by adding these two. They claim to be rated by the National Institute of Occupational Safety and Health, or NIOSH. But the CDC says these are misrepresentations. Both masks are from China.
So we know from the CDC data that upwards of 60–70% of the masks that they tested last year were substandard or fake.
So how can you tell if the mask you're buying is a real N95 or an imposter? Well, Miller says one surefire way is if the company claims it's FDA approved or if it's registered with the FDA.
If you see the FDA logo on the box, if you see somebody marketing their product as FDA approved, that is almost a guarantee that it is a substandard or counterfeit product.
The bottom of the CDC's counterfeit mask page shows examples of the markings a NIOSH-approved mask should have. The CDC lists other counterfeit signs. They include no markings at all on the mask. There's decorative fabric or other add-ons like sequins. And the mask has ear loops instead of headbands. Project N95 also vets their masks and all other PPEs on its website. Miller says they only buy from manufacturers or authorized distributors, and they make sure that the items actually meet the standards that they say they do. Dr. Donna Murphy sits on the Texas Medical Association's COVID-19 task force. He says we must be prepared for what's next.
So we need to be getting ready for another wave of COVID that is more contagious and that spreads more rapidly. And we need to be thinking about how to protect the elderly and anyone who is not healthy.
Dr. Murphy says we do that by wearing masks, getting vaccinated and getting boosted, and by improving ventilation, all in hopes of trying to slow the spread of this latest COVID-19 variant. For the KVUE Defenders, I'm Jenny Lee.